I'm Dr. Arora from Apollo Cradle, Sector 14. Today I'm going to talk to you regarding the high-risk pregnancy. I'm sure you must have heard about this terminology. Either any of your colleague or some relative might have been told that she has got a high-risk pregnancy. Now, what does it really mean, the word high risk? It means that the patient has got some kind of a risk factor which can affect the mother, the unborn child, or both of them. And it can affect during pregnancy, and even the factors can affect her after the delivery also. So these are the high risk pregnancy. Now, what are those factors which can complicate a pregnancy? Now, these factors can be there in a mother before she conceives and she does not know about it. Or these factors can develop during the pregnancy and they can also develop after the delivery. Now, the factors which are there before the pregnancy, for example, if the mother is diabetic, during pregnancy, this diabetes can go out of control or it may not be get under the control, and this can affect both the mother and the child. Now, before pregnancy, if she has got high blood pressure, again it can affect the mother, it can affect the baby, and it can also affect her after the delivery is concerned. Thirdly, if the patient is anemic, her hemoglobin is very low, she is not fit to carry on the pregnancy, so it can affect her during the pregnancy. It may not affect the baby, but the delivery can be at a risk in this particular patient. So these are some of the factors which are pre-existing, that before the patient has conceived, she has got these particular factors. Now let us come to during the pregnancy. What are the factors which can develop during the pregnancy? Now during pregnancy, everything may go on normal. In the first trimester, she may have some bleeding. And this particular bleeding can be either she is threatening to abort or she develops a pregnancy which is in the fallopian tube. Now this is highly risk pregnancy, and in case it is not tackled in time, well, the patient can land up with a severe complication. Now if she has crossed about 8 weeks of pregnancy, the pregnancy may go on very well, and the first trimester, that is up to 12 weeks, she may not have any problem. Now, in the second trimester, what we call is between 12 to 28 weeks, the risk factor what the mother can have is again high blood pressure, which can affect her. It can affect the baby, and it can affect her even later on. Now, in second trimester, even if the patient was not diabetic to begin with, her glucose levels can go up. What we call it as a gestational diabetes. And this has to be tackled. She might have to be put on a diet. She might have been put on some kind of a treatment so that her blood sugar is under control and it does not affect her baby. So these are some of the factors which develop during second trimester of the pregnancy. Now to begin with, suppose the patient has got a multiple pregnancy. Multiple means more than one. She is carrying twin pregnancy. The twin pregnancy will definitely label as a high-risk pregnancy because the main risk factor in a multiple pregnancy is that the patient can go into a preterm labor. So it can affect the mother and it can affect the babies, that if they are born preterm or early in this thing, so they suffer from the effect of the prematurity. Sometimes the patient may develop her amniotic fluid may leak as she has drained. Now this can again affect the mother, it can affect the baby, or it can affect both of them. So these are the risk factors which develop in the second trimester of the pregnancy. Now what happens in the third trimester? So everything is gone through normally. After 28 weeks of pregnancy, the risk factor can be, well, if she is not carrying a multiple pregnancy, the pregnancy is singleton. Now the risk factor is number one, again the high blood pressure. The high blood pressure which occurs because of the pregnancy occurs normally after 20 weeks of pregnancy, till the time of delivery or sometimes even later on. So that is why when a patient comes for an antenatal checkup, we always check her blood pressure to ensure that the blood pressure is not rising. Now to see whether she is developing gestational diabetes, we always do some tests which have been done earlier, and at about 28 weeks of pregnancy, we do a glucose tolerance test to see whether her sugar levels are under control and it is she is not developing any diabetic features. So these are the problems which occur in the third trimester of the pregnancy. Now later on, the patient again can have a premature delivery, she can go into preterm labor, she can rupture her membranes, and she can land up with the complications. Now, can patient work during a high-risk pregnancy? Now there is a question which Gurjeet Kaur has asked, whether a patient can work during the pregnancy. Now it depends on what kind of a risk factor she has got. Now suppose the patient is Rh negative, her husband is Rh positive, we label her as a case of high-risk pregnancy, but she can certainly work. She has got no problem, she does not require any bed rest and she can work. On the other hand, suppose the patient has got low-lying placenta. The placenta is there, she can bleed at any time, so we normally recommend the patient should stay at home and not venture outside because this bleeding can be unpredictable. So depending on the risk factor, we tell whether the patient can work or the patient cannot work. Normally, I always recommend and I prefer that the patient's work schedule is not disturbed. So we have lots of medication which we can treat depending on what is the kind of risk factor that the patient has got. So I must tell you that we call the patient for antenatal checkup. Why we call a patient for antenatal checkup? Mainly to see that she is not developing any risk factor and the baby is growing normally and the baby is not under any kind of a risk. So these are the one, the whole aim is to carry on her pregnancy smoothly so that she delivers normally and both mother and child go home in a good healthy condition. So these are the some of the risk factors. Now in this particular time it's very difficult for me to explain everything and it is not required also, because if I tell you number of conditions, I'm sure all of you are going to think that, oh God, I'm going to have a high risk pregnancy. I can assure you that almost 90% of the women do not develop any kind of a complication provided they are coming for a regular antenatal checkup. As an obstetrician, my main role is that my patients sail through the pregnancy and go home with the healthy mother and the healthy child. Now, in case you people have got any kind of a question, you can post and then I will be able to answer. Thank you.